The AHA's Distinguished Service Award recognizes a lifetime of achievement in healthcare leadership. Today, we honor Dr. Tom Royer, whose passion for patients, generous nature, and visionary leadership make him an extraordinary individual. A practicing surgeon, Tom's brilliant career has touched the lives of millions of Americans at places like Geisinger Medical Center, Johns Hopkins, and Henry Ford Health System. In 1999, Tom took the helm of the newly formed CHRISTUS Health, which today consists of more than 50 acute and long-term care facilities in the U.S. and Mexico. In characteristic fashion, he moved the organization along the path to excellence, using transparency and data to continuously push for better patient outcomes and financial stewardship. At Tom's core is his moral conviction to serve. When disaster struck Haiti last year, Tom led a team to Port-au-Prince to care for the injured, and he and his wife, Jane, were instrumental in opening the first Ronald McDonald House in rural America. Tom has been a valued and active member of the AHA, serving on the Board of Trustees and chairing task forces on physician engagement and quality and patient safety. He's also served on the board of the Coalition to Protect America's Healthcare. Tom, as an administrator, physician, mentor, and colleague, you truly deserve the AHA's highest honor. You have set a standard against which the service of others will be measured. Thank you and congratulations from the American Hospital Association.
I would say Tom's philosophy as a CEO is one of enabling. He relates to each person as an individual. He understands your personality, he understands your strengths as well as your weaknesses. And so he is really a mentor more than a boss. And in doing that, he elicits the best of each person. One of the things I love most about Tom is his ability to receive ideas and to latch on to them. He took on futures planning, a 10-year look, when most people would have said, how are you going to survive the next 3 months? Looking ahead 10 years at that time enabled us to focus, enabled us to orient ourselves to where we are today, which is a very successful healthcare entity. And that's the mark of a true leader.
And it was very evident to me that this leader was going to take us places, that he was not going to settle for the status quo. CHRISTUS Health experienced many hurricanes, and he was the type of leader that was very present and visible. He was there to be able to make sure that the patients, the associates, and the physicians were safe. He is mission-driven. He's as comfortable in the boardroom as he is in disasters.
It's not just the physical catastrophes that he worries about, but economic ones, as well as physician relationships, what happens if the government changed rules and regulations. He's always insisting on what are our plan Bs.
Tom is really about transformational leadership, and so his focus is always about transforming not only himself, not only the team, but all of society in a way that whatever happens or whatever is done has a positive impact or a beneficial impact, not only on the system itself, but also on the community.
If you ever wanted to think about what might not be on a CEO's bio, songwriter probably is not one. But Dr. Royer wrote a song, the Christus Prayer. And it's a song that we sing at times through our history at CHRISTUS, and it's a remarkable song that's very, very upbeat and positive and inspiring. And so he sings it, we've sung it, and he also makes rounds at Christmas time and does caroling.
Tom's impact on healthcare, not only just within CHRISTUS Health, but in America as a whole, is his major commitment upon what is best for the patient. And you'll hear him say many times, we need to be making our decision based upon if that parent's child is in the middle of the room as a patient.
Tom has been a real advocate for transparency, and he's made that clear in speeches. He's made that clear among his people, very transparent very early, before it was right to be transparent. You get a chance in your life to meet with 4 or 5 great people. Tom Royer is one of those guys that you just want to hang with him. You just want to stay with him and just listen to him, just kind of soak it up.
Well, my father at home, growing up, managed to, keep his job at the hospital straight and put in the hours he needed to put in there, but then also managed to go to all our student activities and then managed to do the things around the house a typical father does, including taking care of the lawn and the yard and sweeping the front walk, which he loved to do.
He is loaded with energy, and it took a long time for me to catch up with him. But after 43 years, I think I know the tricks to do that. The kids are most important to us, and his attention to the family. He loves what he's doing. He loves children. He loves his work. I've not ever heard him say he was unhappy in any of his work.
From a very early age, as early as I can remember, I always wanted to be a physician, and I think that's because my father sort of was a plant manager and he did the first aid in a lime company plant. My mother sort of took care of the people on the street in a first aid way. They weren't in medicine. And I think probably that all influenced me, and so for my entire schooling, I always thought I wanted to be a doctor. I've always recognized that quality and excellence comes from the kinds of people that are working in an organization. And so from day one in Christus and in any other organization, I have said we will spend a lot of time and resources on education and training. It is an honor to take care of people. So regardless of how difficult the financial situation gets, how much reimbursement changes, what healthcare reform does to us, I would ask them to always remember, and I try to tell people in the record room that aren't seeing patients, that are parking our cars, that are cooking our food, you are practicing and have been called to a sacred ministry. And to me, that gives you the passion and the energy to get up in the morning, face any challenge you have, and go to bed at night saying, I've made a great contribution, and if I died tonight, I will have made the world better because I will have touched someone.